Hey, Dr. Rory Cernick here with the Hearing Assessment Center. Let's talk about balance. Unfortunately, most of us at some point in our lives will experience some type of dizziness and or vertigo. Let's talk about the most common cause, and that is BPPV, benign paroxysmal positional vertigo, or also known as having crystals in your ears. To better understand what these crystals are, we need to review some anatomy in the inner ear. We have the cochlea, which is the sense organ of hearing, and adjacent we have what is called a semicircular canal. There's 3 of them, and they're all fluid-filled, and in fixed areas, we have bunches of these calcium carbonate crystals, and they're called otoconia. When someone develops BPPV, these crystals become dislodged, and they start to free float in that fluid. Then gravity takes place, and when these crystals are floating and dropping, our brain and our ear and our eyes think that our body is in motion. So when there's this displacement of crystals, there's a mismatch between our ears and our eyes and our brain, and that creates that spinning sensation. It's important to understand that with true BPPV, there are no other symptoms. There are no neurologic symptoms. There is no additional hearing loss or headache or tinnitus. You just have that spinning or vertigo sensation. Looking at the prevalence, BPPV will have an impact on 50% of the population. It is very atypical in childhood to develop these symptoms. Above the age of 50 and as we get older, we are more likely to experience this. We really don't know any true cause of this condition or these symptoms. Sometimes after a significant head trauma, some people may experience BPPV because of those crystals being displaced, but it is largely associated with head movement, and most people will get or develop BPPV while they are sleeping. Typically, when they get up in the morning, they will roll to one side, and boom, just like that, they start to have these symptoms. BPPV is also the most common type of vertigo, and that's important to know because a top 3 reason of hospitalizations in our country is dizziness. Now, yes, most of those individuals are dehydrated, but we all need to understand and separate BPPV from dehydration or other neurological conditions. Fortunately, this condition is very easy to diagnose, and all it takes in the office is to lie the individual down and put their head and body in different positions to try to create or evoke that vertigo. And in doing so, if we have those crystals that are free floating, gravity is going to take place and create that mismatched signal between the ear and the brain. And the result is that there is a nystagmus viewable in the eye. And what that means, the large part of the eye just has a rotational force or emphasis. Oftentimes, people experiencing this condition can actually feel their eyes moving and rotating. So next, let's talk about how we can successfully treat this in the office. Unfortunately, still many primary care doctors have a difficult time separating BPPV from other inflammation, motion sickness, dehydration, etc. Oftentimes, people with this condition will be prescribed and take meclizine, which is a very heavy-duty central nervous system suppressant. That is not going to fix or alleviate this type of symptom. But what we do in the office, again, once we identify that nystagmus, we can essentially, through various maneuvers, the Epley is the most common, we can put those dislodged crystals back into the appropriate part of the canal. We have about a 90% effective rate with treatment, which is outstanding. This is one of the things in medicine that when we can clearly identify this, if we can diagnose it and treat it properly via the Epley maneuver, odds are after the first or second session, those symptoms are going to completely dissipate. So what does having BPPV feel like? Fortunately, I have never experienced this, but we've had many, obviously, patients and family and friends who have also had that. It is a sensation of spinning. Either you feel like you're spinning or the environment is spinning, but the important characteristic is that this is very short in duration. The symptoms almost never last more than 60 seconds. Just know that if you roll to the right side and it creates that vertigo, try not to go back in that position until we can see you in the office. Many folks will take it upon themselves to Google this and they will find at-home remedies. I never initially will recommend at-home treatment. Perhaps knowing that there is a 50% chance this will return in the next 5 years, at some point down the road we can talk about that, but initially we need to have you come in, perform a basic neurological examination, look at your eyes, look at your neck, and after treatment, if we can successfully alleviate your symptoms via the epilepsy, down the road we can discuss at-home exercises should this happen again in the future. So let me leave and say this: stay well, stay healthy, please stay hydrated. Again, the number one reason people are in the hospital because of dizziness is simply that we're dehydrated. So stay healthy, stay hydrated. Talk to you next time.